Sometimes families don't realize how life can change with just one diagnosis. You're going about your day and suddenly you're faced with caring for a parent who worked decades in an industry you never thought twice about. Then someone mentions benefits programs you've never heard of, and you're left asking, why didn't anyone tell us this sooner? Hi, I'm Dale Corpus, a senior transition specialist and real estate expert based in the San Francisco Bay Area. And I'm also part of the sandwich generation, balancing care for my own parents while raising my family. I created the Simplify Senior Transitions podcast to make senior living and caregiving conversations easier. Here's my promise to you. Every episode brings you real stories, practical tools, and expert insights so you and your loved one can move forward with confidence instead of stress. On today's episode, I'm joined by April Sanchez and Angela Walker, both from Hallway Healthcare. Together, they're raising awareness about the Energy Employee Occupational Illness Compensation Program, a benefit that supports former nuclear and federal workers, and they're walking families through a system that can otherwise feel overwhelming. We'll talk about how they build trust in the community, how they educate families at senior centers and health fairs, and why advocacy and empathy go hand in this kind of work. So if you've ever wondered how families discover programs like these, what it feels like for workers and spouses finally getting help, and what resources exist right here in our communities, you're going to get a lot out of this one. Let's dive in.
Welcome to the Simplify Senior Transitions podcast, where we help families navigate senior living, real estate, and everything in between. Hosted by Senior Transition Specialist Dale Corpus, this show brings you expert insights, real solutions, and stress-free strategies to make senior transitions simple. Ready to dive in? Let's go.
And we are back, everybody. April and Angela, welcome to the podcast today. How are you?
Good. How about yourself?
I'm good. It's a great Friday morning, so happy Friday to you. I want to start with you, April. How did your journey lead into community engagement and marketing for Hallway Healthcare?
Well, first of all, I love connecting with people. So there's that. Second, one of my first jobs out of college was being a marketing analyst for a company that actually owned assisted living and skilled nursing facilities.
Yeah.
So I worked directly with the marketing director and the events coordinator. So I got to see them build our brand and put it out there for the community. And I said, one day I want to do that. And Hallway Healthcare gave me that opportunity. So it's been great.
And Angela, how about you? What motivated you to step into the resource liaison role and focus on guiding families through Energy Employee Occupational Illness Compensation Program, or EEOICP? Is that what you guys refer it to as?
Yes, the abbreviation, the long-winded one to say. But I've always been in sales and customer service. And also in past, I worked at an affordable senior living community, and I saw the struggles for seniors financially and also the resources that they lack. So when I learned about this program and that the main people that are impacted by this program and worked out the laboratory are our seniors, they already have developing conditions, and it's a very complex program. And I wanted to use my relationship skills and customer service and knowledge to be able to help them navigate and have somebody that they can rely on to get them to an end result that benefits them with this program.
Excellent. Now, for both of you, what personal experiences or stories fuel your passion for this work every day?
For me, the success stories that we get come straight to my desk, and I get to put those out there on social media. So I get to read all the success stories and see how Hallway Healthcare has changed lives. And for me, that's what really fuels my passion. I want more of those success stories.
Okay. And then Angela, how about you?
So my family has a personal experience where my mom was a caregiver for my grandma 24/7, and we didn't have the resources or the money to pay for care. And it took its toll on my mom emotionally, mentally, physically. So jumping into this role and seeing other family members experience those struggles, and it changes the dynamic of a relationship from family member to caregiver, and being able to provide relief with a program that can provide those resources for free. It's very blessed to be in this position and help those individuals.
I get that. Thank you. So How would you describe Hallway Healthcare's mission in simple terms for someone hearing about it for the first time?
Well, in simple terms, our mission statement is stop getting by and get better. Yeah. And with that, we don't just stop with being a home care provider. We go above and beyond and we walk them through all the step of the way. So the paperwork, pulling their medical records, navigating through the process, providing the resources and the phone numbers to who to call so that they can get through the program. So we're holding their hand every step of the way so that they feel supported.
Okay. And April, you're often the first face families see. How do you build trust quickly with people who may be skeptical?
So, first and foremost, I like to listen to the families when I run into them at senior centers, health fairs, things like that. I listen to their wants and their needs. I also make sure that we are out there in the community so much that if we're not the first face they see, whoever the first face is will recommend us because they know us.
Okay. And Angela, walk us through what it looks like when you first meet a former DOE worker or their spouse. What's the process like?
So whether I meet them at an event like a health fair or call them by phone and introduce myself and give them a brief about our company and the program, I'll schedule a visit. I want them to be comfortable in their home. I sometimes will bring an RN case manager so they can do a quick assessment of the person based off of the simple information I've already gathered from our experience or our first touch. And then I give another summary of the program, find out their job title, what years they worked at the laboratory, which facilities did they work at, because in most cases, they didn't just work at one, they were a contractor. So they would go to many facilities. And so I'd help them remember that information, find out what illnesses or conditions that they are facing, have them sign medical release forms. Because as a home health provider, we pull their medical records and we review them and we can be like, Dale, we want you to call the Resource Center and file for X, Y, and Z, and let's get going with your claim. So I just asking the pressing questions to identify can I also help them prepare for the interview. So when DOL claim and file, I make sure we get those information down. And so they know and it's already there for them when they're being asked those questions about their work history.
Okay, got it. Let's transition into awareness and education. First question here is, why do you think so many families don't know about the EEOICP program in the first place?
It's not widely spread. The laboratories we find doesn't really acknowledge it, or they do, but they just don't talk about it or advertise it. Most families or most individuals that worked at the laboratory, this program actually started once they retired. So they're
Okay.
already retired and not at facility getting conditions, and they're just unaware of the program and they only find out about it in passing with colleagues who were able to get help with them or events that we do, health fairs and touching senior living communities.
So how do you get the word out to local communities? You mentioned some with that answer, but are there any other ways?
Yeah, and I book help with that one. So we work really closely with a lot of assisted living communities,
Yeah.
rehab centers, things like that. We also get out there and I sign us up for any event in the Bay Area that we could possibly do.
Yeah.
So if we can be there, we will be there.
Okay.
We're also part of many chambers of commerce. And then I do the social media. So I'm always promoting us and I'm always in someone's LinkedIn inbox.
Okay. Oh, forgot to ask this question. Where are you guys based out of and where can you help people?
Perfect. Yeah. So we're based out of Dublin. So our primary area is the Northern California Bay Area because of the three facilities that are currently active with Lawrence Livermore, Lawrence Berkeley, and Sandia. But we can go anywhere. This is a federal program. So if there's anybody in another state that has been affected, we can go there. We're currently in 7 states and growing. And so our role and our hope is to spread the knowledge of this program and help as many people as possible.
What are some of the most common misconceptions families have when they first hear about this program?
That it's too good to be true. That's the biggest thing that I encounter being the person. So as a resource liaison, I'm responsible for finding these individuals and educating them on it. So a lot of times I'll be making phone calls and I get hung up on, sorry, I'm not interested. This sounds like a scam. So just try to reassure them. The next one is that it costs money or that our services cost, and we're free. We want them to know about this. We want them to receive their benefit. And so that's the next misconception. And then the final one is that they think that they have to be really sick to qualify. And that's not the case. Any condition could possibly be qualifiable with this program. Our role and goal is to hopefully find them before they're really sick, because we want them to maintain a quality of life and provide them that care and support and proactiveness to maintain that health.
How do you explain the difference between what you do at Hallway Healthcare versus other organizations in this space?
As far as that goes, is we're all out for the same purpose to
Yeah.
helping these former nuclear workers, but we don't stop with helping them navigate through the process and entering the home. Once they're in the home, we still continue to care for them and see if there's any new conditions
Yeah.
or that they get their impairment every 2 years, because what that means is new conditions are more compensation, more money for them. And that's crucial in this time with seniors that are on a fixed income. The additional things to that is benefit. So if they now get diagnosed with a lung condition that requires inhalers, well, those medications or inhalers are now reimbursable and covered by Department of Labor. So those little copays all add up and still help them financially. And then lastly, additional conditions mean possibly more care. So if we're only caring for them and only have approval for 4 hours, 3 days a week, new conditions or worsened conditions could mean 12 hours, 24/7. And that makes a huge difference for them and their care. We want to make sure that their continued day of living is that it's the continued day, not struggling.
Yeah, I understand.
Also, we differ in some ways because unlike home care where it's just caregivers, we offer LVNs and RNs. We really can get in there and provide the skilled nursing that they need so they can actually remain in the home the rest of their lives.
Yeah.
Yeah.
So just, yeah, for clarification, that means you guys are offering medical support versus caregivers that do non-medical caregiving, right?
Yeah, and that means medication management. Individuals that are diabetic and need insulin, we're able to administer also to prevent infection. UTIs and pneumonia are the most common things that happen, and we're able to help prevent that because we don't want them to go to the ER or the hospital and that exposure. So being able to prevent those things does help substantially.
Hey, what emotions do you usually see in families when they first learn they qualify for benefits?
Well, the skepticism, first of all, too good to be true, back to that one, and then hope. So then as we start the process, which is a very long one, it is Department of Labor, so it can take months, possibly over a year,
Okay.
to be qualified and go through it start to finish. But then release when they finally get to that point and being able to celebrate steps that we're moving forward with the program, because I'm always having touches with them. So I'm always keeping them updated. They're calling me when they get new letters, and we're working together and reassuring them that just be patient, it's going to come. And the relief they feel is like a weight of bricks off their shoulders. And to be able to celebrate with them in that and provide them that relief is a blessing. And that's all
Yeah.
we can pretty much say.
Yeah. Can you share a moment when a family's stress or uncertainty turned into relief because of your guidance?
Yeah, so I have just a couple that come to mind, but one of them is a home that they were paying for caregivers 24/7,
Right.
over $100,000 out of pocket in a matter of a year. The
Yeah.
going rate is at least $45 for caregivers. And I told them about the program. We went through it, we navigated it, and now they have not only an RN, LVN 24/7, but we also have a caregiver because this gentleman is so progressed with his condition that he needs the two-person assist support. And we're able to provide that for free for those two individuals from the Department of Labor.
Oh, nice. And April, you've talked about creating community presence. How does visibility and credibility help families trust the process?
Well, the more they see us out there, the more people get to know about us and know about the program. And then people that we come in contact with in the professional field can also help us. And then we seem credible. And then they trust us. They trust these people. So if they're a trusted source, then if they recommend us, these professionals recommend us, then these families are more likely to go with us. For an example, we have a great relationship with a local assisted living community, and they send us a lot of referrals. And right now we're in the process of turning a lot of them into patients. And
Okay.
that's very exciting.
Excellent. Now, Angela, what's one success story that has really stuck with you personally?
So anybody that we're able to help with hallway healthcare, we call it a success. But one in particular that is very recent, one of the case manager RNs and I went to a home of an individual that was already qualified. So they've already gone through the program, have a white card. And in talking to the spouses, we learned that the individual was going to enter a facility the following week. And we told her further what we can do and an additional condition that hadn't been filed yet that would deem 24/7 home care. And so we were able to put on, she trusted us. She
Yeah.
trusted what we were saying. She didn't want her spouse to go to this facility. Who wants her spouse to go to a facility? There's money involved. And then essentially you're sending them off. And when they have certain conditions, it's a scary environment of the unknown and what they're not familiar with. And so she trusted us, trusted the process. And within a matter of 4 to 6 weeks, we are now in the home 24/7. So she gets that relief and comfort of her spouse being there with her. He's safe and, they get to be together for the remainder of his time and plus the compensation that came with that. So that is just one that I'm very proud of to be a part of. And we got there in the nick of time.
Yeah. That's amazing. Great success story. And it's really making a difference in people's lives. Yeah. What are some of the biggest challenges families face when navigating this program?
The time frame. When you put a time frame, when it's a 6-month to 12-month process, that feels like eternity when you're already struggling. And so when we're entering the home to try and help them navigate, the waiting time is the biggest struggle for everyone. And I'm so impatient. I struggle just as much with the wait time for all of this for my individuals that we're getting through the process. So just reassuring them that it's going to take this time, setting the expectations of like, they already know that
Yeah.
it's going to be time, but it's going to happen, and just them trusting it. And, again, the relief at the end and the success to be able to share that and give them the phone call and be like, hey, Susie Q, guess what? Your father was just approved. Okay, now here's the next step. Here's what we have to prepare for. Let me know when these come. So that's the struggles, is the time frame, the paperwork, the roadblocks we encounter, because there are always roadblocks that we have to overcome.
Okay. Now, April, what challenges do you personally face in outreach and how do you overcome them?
I think that my biggest challenge is spreading awareness. It's just really getting out there and educating people on the program and the fact that it's there.
Mhm.
We try really hard to get into assisted living and rehab centers for the simple fact that we ask them, when you ask someone if they're a veteran, could your next question be, were you a former nuclear worker? Because just like veterans, there's a program for them. So there are many ways where we can slide things in and just make more awareness. So I think that is the hardest part.
That's excellent. Now, Angela, how do you keep families encouraged when the process feels slow or confusing?
Communication, reaching out, to get into the start of the process, there's already a relationship that we are establishing and building and trust. And so once we've gotten to that point and the process can seem like eternity, just reaching out to them, saying, hi, hey, have you received anything? Okay, well, it should be coming now. Watch your mailbox. Call me as soon as you get something. Stopping by to maybe do a coffee date with the individual to just know that I'm still here and that they're being supported. So any way that we can continue the relationship, and that doesn't even end once they do become a patient. My relationships with my patients that have already been established, they continue on while I'm also meeting and making new relationships with claimants that we hope to turn into patients.
Okay. Now, what's the toughest part of your job and what keeps you going despite all that?
I think the toughest part goes back to the challenge of building awareness, really getting out there and letting people know that this program exists.
Awareness, time frame, denials when they get a denial and we have to appeal it or overcome that, or further development of information that department. So there's many things that end up going into one with all the challenges that we help them face and we help them navigate.
Yeah. Okay. Can you talk about why networking in local business communities is so important in this work?
I believe that it's all about the consistency, just
Okay.
showing up, showing our face, getting to know people. The more that the professional community knows about us, then the more likely they are to recommend us when
Yeah.
someone needs help, one of their families needs help.
Okay.
And it helps increase our touch too. So meanwhile, while we're doing the health fairs and assisted living communities, they also have a whole network of seniors that they are already in contact with or are seeing. So then it just gets us that additional reach to support our seniors, which it's a team. We're all a team, essentially. It takes a village. And when our patients or individuals we're working with need additional support and resources that we can't provide, we have a network that we can refer them to and support together. It takes a community to take care of our seniors.
Yeah. Now, when families need more than just benefits navigation, how do you connect them with additional resources?
And I think that goes back to our relationships we have built with other senior professionals or the community. We've established so many connections now that I think we have a resource for everything at this point and growing.
If someone needs something, we have a network to refer them to. For sure.
And what kind of impact does this work have on the broader senior community beyond just the individuals you serve?
Well, as far as the senior community, they're the ones that most often don't have voices for themselves. Like I said before, they're on fixed income. It takes a community and being able to help a fraction of those individuals helps the overall goal that we are trying to obtain is that care, compensation to individuals or just the resources. So if we can just help a fraction of our community, then we'll support the rest of our senior professionals to help us impact the remaining of our senior community.
Okay. How do families usually pay it forward once they've gone through the program? Do they tend to tell others, advocate, or spread the word?
Well, you usually know how when someone has a bad experience, they tell people. When someone has a great experience, they tell even more people. So when we've been able to assist somebody and provide relief for an individual or family, they refer us and shout off the rooftops from us. Yeah, one individual who actually doesn't even receive care yet. He's still pretty active and independent, but he is referring to people to us pretty much every week. And he's like, oh, my friend Joe needs some help. And so referrals are huge. When somebody is happy with what you have done for them or a relationship that has built and trusted, then they're going to refer us. And we hope to help everybody.
Okay. April, what have you learned about the importance of showing up consistently in the community?
Well, consistency builds familiarity. So if I'm consistently out there, we're consistently out there, then our expansion grows, our knowledge base grows. People can refer us if they hear about someone who needs help specifically in this situation with this program. So I just think constantly being out there and showing our face really will build our brand.
Angela, what do you think families most need to hear about hope and options when they're feeling discouraged?
There are options. There are resources. You're not alone. We're in it together. We fight. If you're not sure about whether your loved one is eligible for these benefits, reach out, ask us. We'll answer any question. We'll ask the questions needed to determine that. And, there's light at the end of the tunnel.
Okay. What excites each of you most about the future of hallway healthcare?
Well, I know that I'm very excited that Angela and I have been out in our community so much that we're actually hiring a couple new resource liaisons in this area.
Nice.
So that makes us very excited about the future.
And I'm excited about the growth with those new people coming on, as well as new partnerships and relationships that we've built that will open more opportunity for us to enter states that we're not currently in and help for their individuals with this program and care. If anybody needs our help, we will go where they go.
Perfect. And if families listening today want to explore whether their loved one might qualify for benefits, what's the first step they should take?
Call our office, call April or I directly, call our home office in Dublin, and you'll be directed to a resource liaison, and we'll be able to, identify whether or not they're eligible and provide you with the first steps to get going with the claim.
Another thing they could also do is attend our monthly brunch, which is the third Wednesday of every month. And that's usually located in our office from 10 to 12. And we always educate and provide help if needed.
And finally, how can someone reach out to you? And what's one message you'd want every caregiver or adult child listening to take away from this conversation?
You're not alone. You're not alone. You have a whole team of people willing to help you. Just need the resources. And whether it's the resources that we can provide, if not, then we have individuals that can provide the resources. We're in it together, essentially, we can provide relief and support to them.
Yeah, we'll walk you the whole way through.
April and Angela, thank you so much for joining me today. And thanks for sharing the incredible work you're doing with Hallway Healthcare. I know our listeners and viewers will walk away with both knowledge and hope after hearing this. And for those of you listening, if you think your loved one may qualify for EEOICP benefits or just want to learn more, visit hallwayhealthcare.com. You can also reach out directly to April and Angela, and I'll have their contact information in the show notes. And don't forget, if your loved one is considering senior living and you need to figure out what to do with their home, you can schedule a free consultation and learn more about my services at www.simplifyseniortransitions.com or send me a DM on Instagram at soldbydale. If you enjoyed this episode, please leave a 5-star review on Apple Podcasts or Spotify and share it with someone who might need this information. It really helps more families discover these resources. Thanks for tuning in. And I'll see you all in the next episode of the Simplify Senior Transitions podcast.